Students, I'm the OGGuru Dr. Punit Bhojani here with a single point agenda to make OBGY your most favorite subject, most scoring subject. Very important video, lots of phone calls we are getting that, sir, what do I revise in the last 7 to 8 days in OBGY for the upcoming NEET PG? So here's my prediction and the hit list for the upcoming NEET PG August 2026 in OBGY. Feel free to get in touch with me on phone and WhatsApp on this number. I'm going to tell you what are the must-know topics, which topics you can also skip, and which topics are virgin MCQs that is never asked now but will come in the future exams. So stay right till the very end. It's going to be a very important video. And before that, download the OGGuru app, and thank you for the blockbuster response. So many of you had enrolled live classes and now this recording is available. My dear students, this rank booster OBGY, just give 4 hours. You will be able to revise. It's a rapid revision course. We had 6 hours live recording. Easily you can see it at 1.5x speed. So in 4 hours and just in 249 rupees, you will be able to revise your entire obstetrics and gynecology through MCQs. What have I covered? I have covered the image-based MCQs and the video-based MCQ, clinical MCQs, and the most expected MCQ. So 3 sessions we had conducted of around 2 hours. There were 6 hours live classes. Many of you had enrolled, but those who have missed out, recording is available and it's only 249. This is tremendously going to boost up your rank in OBGY because it's a single most important subject. 18 to 20 MCQs are going to come. So whichever source OBGY you have studied, don't worry, just enroll in this and very quickly just give 4 hours on my app and you're going to get benefit, and lots of MCQs are going to come from those sessions and your score in OBGY will be the maximum. Now, as overall we know that for OBGY, when it was a 200 mark paper, 20 to 22 MCQs were asked every year. Now slightly the marks has reduced and now from 200 we have 180. Still we can 100% expect 18 to 20 MCQs coming in OBGY, 20 for sure. So if 20 MCQs are going to come in OBGY, then roughly out of the 10, it's a almost equal division. Gynecology, we can expect 9 to 10 MCQs, and same with obstetrics also we can expect 9 to 10 MCQs. So this is gynac, this is obs. Both I will tell you, but first starting with gynecology. 5-star topics. What is the meaning of 5-star topics? Compulsory. Don't miss out. You have to do all this. And the first and foremost, the PCOS or the PMOS, all the latest guidelines. The Rotterdam criteria is a new thing. Basically, it is a big chunk of infertility. Now, when I asked you infertility, it means the PCOS. Don't forget short MCQ. Endometriosis. Again, one MCQ, very hot topic. Endometriosis is coming every year. Don't forget to do the laparoscopy findings, the management, all that. So PCOS, endometriosis, hysterolaparoscopy, extremely important. Lots of images, videos can come. When to do hysteroscopy, when to do laparoscopy, for which Mullerian anomaly we should know very well. HSG correlation, also hysterosalpingography correlation in this infertility with hysterolaparoscopy findings, all that could be asked to you. So it is a very big chunk based on which 3-4 questions. So each topic I'm writing is 1 MCQ. So PCOS 1 MCQ, endometriosis 1 MCQ, Mullerian anomaly 1 MCQ, hysterolaparoscopy 1 to 2 MCQ. Is it clear to all of you? Next, very important, primary amenorrhea. Again, every year the MCQ comes, you have to do it. Okay, I'm also going to tell you the less important topics which has never been asked. Okay, so primary amenorrhea, cryptomenorrhea, also very important. So that again 1 to 2 questions. Then extremely important, contraception. In contraception, specifically focus on the recent MTP changes, the MTP Act, which method you will do. So MTP you need to do perfectly fine, and focus on the OC pills and IUCD. Okay, OC pills and IUCD, those are the popular topics in contraception. Surely question comes. So infertility, big chunk, 3-4 MCQs will come from infertility. Amenorrhea topic 1 to 2 MCQs, contraception 1 to 2. Then when we move on to menorrhagia or heavy menstrual bleeding, again short, very important, with specifically importance in the perimenopausal and postmenopausal bleeding. So focus on heavy menstrual bleeding topic, which is very important. Short, every year the question comes, what management we do, how do we proceed, what is to be done, what are the treatment options available. Okay, fibroids may or may not come, not so important, so that we can write on the next page because it's the less important topics. Okay, fibroids sometimes may come, Prolapse again has never been asked so much. Do not forget about urogynecology, and specifically in urogynecology we need not do very less frequently as like SUI all the topic, but urogynecology mein genitourinary fistula, that is specifically VVF or genitourinary fistula. Do not forget, of course, the cervical cancer, the most important oncology mein CA cervix. Every year question comes specifically with the stage wise management of cervical cancer. What stage will you do, what management? And lastly, very simple topic, but every year again it comes, do not miss out vaginal infections. So that, my dear student, should be your gynac paper for sure. Just I'll mark it in this. Okay, so basically PCOS 1 MCQ, endometriosis 1 MCQ, mural anomalies, hysterolaparoscopy, primary matter of 1 marks I'm saying. Okay, here again you can get 2 MCQ, 6 menorrhagia, 7th, and your 8th and 9th and 10th. So this, my dear student, will be your gynac paper. You will thank me on the day of the NEETPG. Is my guarantee. Or these topics you have to do. What less or which are skipping the topics? So again, menopause. Okay, menopause, HRT, never ever asked. Again, secondary amenorrhea is hardly ever asked, or you can skip it. I'll tell you it can come in the virgin MCQ, so that you can skip. Then your, as I said, fibroids less likely have been asked come in the last few years, but prolapse also very important. Prolapse ka, however, so many years questions are not regularly coming. So these topics you may skip if the time is less. And of course, other cancers like the ovarian cancer, endometrium cancer, cervical cancer do very well, and also endometrial cancer you may want to do, because that questions can come on endometrial cancer. Okay, so this is how you focus on. Don't forget about, as I said, contraception, MTP, heavy menstrual bleeding, fibroids may or may not come, and urogynac vaginal infection. So these are very important. And other topics, as I said, like your menopause, HRT, male infertility, your IUI, IVF, male infertility, again less questions are being asked. So this you can skip if time is less. Okay, so secondary amenorrhea, fibroids, prolapse, ovarian cancer, male infert, this you may want to skip if the time is less. And other urogynecology like SUI, ureteric injury, because that could be asking you in your surgery, but ureteric injury, stress urinary incontinence, other kinds of your genital TB, all that less likely. PID, pelvic inflammatory disease, again these topics are not very popular, so you can skip this topic if the time is less. Is this understood? But so focus on these. As I said, these are the 7-star or the 5-star topics. Please do these very well. Vaginal infections, don't forget. Okay, yes. So now moving on to obstetrics, and again, as I said, the first 5-star 7-star topic, which are short. Okay, trisomy 21 antenatal detection, very important. Iske upar 1 to 2 questions, and by this everything. What are the screening tests, the double marker test, triple marker, quadruple marker test, what are the confirmatory test, amnio, CVS, images, everything, when to do which procedure, when to do which test, what is the next logical step, NT scan, all these are very hot topic. Combined antenatal screening jo hota hai, trisomy 21. Next, when you move on to very important active management third stage labor. Normal labor, everything you may not know, but active management third stage labor with the recent advances, surely very important MCQ coming. Do not forget test for fetal well-being like NST, BPP, color Doppler, all that questions are going to come. Test for fetal well-being. Do not forget the drugs. Drugs may specifically your oxytocin and prostaglandins. Prostaglandins, your E1, E2, F2 alpha, which drug is used for which medicine, which condition, all that we should know. Okay, so NT scan, active management, NST, BPP, color Doppler, oxytocin, prostaglandins, very important. Then, as I said, normal labor less important. When you go to the malpresentations, again very important, breech and transverse lie. Some question every year comes, breech, what is the maneuvers, all that, breech and transverse lie, very important. Single most important, PPH. With the recent advances and all the recent guidelines, PPH, do not forget. I've also put a video in the app about the recent advances of PPH. Okay, so that's very important. Then when we go again very important, pre-eclampsia, eclampsia, in and out, single most important, every year question comes, max self, prophylactic max self, impending eclampsia. Okay, so PE is I'm writing pre-eclampsia, eclampsia. Okay, do not forget instrumental delivery, forceps, vacuum, indication, contraindication, which condition you will choose, which instrument, all that extremely important topics. Okay, antepartum hemorrhage, again short, both your abruptio placentae, placenta previa management, everything very important. Do not miss out. Is it clear to all of you? Ectopic pregnancy, specifically with the focus on unruptured ectopic stable patient, they will give you methotrexate. What are the guidelines? Please do not forget that. When you look at medical disorders in pregnancy, at least do these two: heart disease in pregnancy, and diabetes in pregnancy. So gestational diabetes. Okay, I'll come to this also. We'll finish off the, okay, let me just finish off this. Okay, so these are the important things which you should compulsory every year question come. Or kya hai? Yes, 3-4 more small topics: twins or multiple pregnancies, do not forget, and liker disorders matlab your oligohydramnios, polyhydramnios, liker disorders, more liker, less liker, and shoulder dystocia. Again, last couple of years, every year the question is coming. So this, if you see, my dear student, this would cover majority. Trisomy 21 pe 1 to 2 MCQs, NT scan something to do 3, AMTSL 4, this is 5, these are 6 number pe your oxytocin, 7th is your malpresentation, 8th topic, 9th topic, 10, 11. Okay, and number 12 ectopic, this 1 MCQ, 13th, 14th, 15th. Okay, so these are the 13, 14, 15 most important topics. Isme se hi guarantee, from these only obstetrics around 10 MCQs are going to come. So this is how your paper would look like. Less important topics you can skip, something preterm, postdatism, PROM, okay, cord prolapse. Again, as I said, very frequently, very less frequently, or hardly ever asked. PROM, cord prolapse, preterm, your placenta variation, the various physiological changes which take place in pregnancy, hardly ever. Nowadays questions are not coming. Okay, your Likert values and simple numerical values, even normal labor as such, hardly ever questions are coming. And you should know the sequence of events. Of course, active management we should know, but normal labor as such are very less likely to be asked. Then your other medical disorders like anemia in pregnancy, thyroid disorders in pregnancy, all that you can skip if the time is less. Very less questions have hardly ever asked. Your placenta variations, even the topic of IUGR, unless sometimes specifically color Doppler, all that. So these are very rarely or almost you can skip if the time is less. Even specifically last so many years like VBAC, trial of scar, these questions we are not seeing in the last so many papers. So these topics you can safely skip if the time is less. Do not forget one more very important topic over here. Sometimes if they want to make the paper tougher, then the question can come on your not only this, abortions, first trimester, second trimester images, and also RH iso immunization. This is again a very hot topic, can come, RH isoimmunization. So this we can add to our list of the important 5-star topics. Abortion always both in the first trimester and in the second trimester. Those are important topics. Rest, anemia, thyroid, IUGR, VBAC, all these topics we can skip if the time is lesser. And yes, vesicular mole also sometimes is the question is coming. Okay, so vesicular mole management, and this can come. Okay, so this would be the entire list of the important topics of today. These topics you can skip. Now, what are the virgin topics? Now, what is the meaning of virgin topics? The question which have never been asked to you but can come in the future exam. Sinusoidal pattern on NST, the difficult patterns on CTG, sinusoidal pattern hai. Then your variable deceleration, the types of deceleration, ICSI, IVF advances, again IUI, these topics have never come but may come. Forceps decision making MCQ based on the stage station. That means they'll give you a very big clinical case of 4-5 lines and then tell you the station is -3 or +3 and whether will you apply forceps or not. As I said again, do not forget something very hot, new thing, NIPT. Okay, non-invasive prenatal testing. Again, very important screening test, something new which has never been asked, will come in the future exams. RH ISO immunization management, specifically based on the color Doppler findings of MCA. These are virgin MCQs for the future. Labor care guide, PPH recent advances. Okay, so these are virgin MCQs which can be asked for the first time. Similarly, your POPQ classification has come, but the image has never come. So grid classification or IBQ, POPQ can come. Implants, contraceptive implants, implant or never been asked but can come in the future. Secondary amenorrhea, again it is a very important from concept, never asked but can come. NIPT also surely very likely coming in this year exam. So these are virgin topics. Newer drugs, the newer drugs which have been launched in the last few years, specifically your carbetocin. Okay, newer drugs in obstetrics and gynecology like your Dynogest, elagolix, what it is, okay, carbetocin, atosiban. So these are new drugs based on which the MCQs can be coming or could be coming. It's in obstetrics also important and also in gynec and pharmacology also. Dynogest, elagolix, carbetocin, all these are new drugs which have recently been launched and questions are likely to be coming on them for the first time. Now, the big question, will video-based question come? Now, please understand this, that the NEETPG, there was a mock test. So they, in the demo test paper, they don't have them, but don't panic if you get a video-based question. Please understand, video-based questions are very easy. I have a detailed video free for everybody on YouTube. Mostly it is just an extension of your IBQ. So when you look at the video, if they come, and then when you look at the option, definitely you should be able to identify and they will make it very easy. They will give you a classical video denge. So focus on the concepts and you will be able to solve even the video based question. And as I said, this is there free for everybody. This video you can go and see. I put the important video based questions in obstetrics and gynecology. As I said, though the NEETPG demo test is not having it, don't panic. If they come, they are going to be easy. Okay, they will be very easy. They will give you a classical thing. Identification will not be a problem. You will identify, yes, uske baad ka question may be tough. The question may be tough, but identification will not be a problem. If you know your image based questions, then your video based questions will be very easy for all of you. Don't worry about them. Do not forget to familiarize yourself with the NEETPG interface. Attempt the 20-minute mock test available. Okay. Practice how you will move in between the questions, what question you mark for review, and finish the section before the timer goes out. The detail of all this, okay, I have put it on, it's available on my Instagram profile, link and screenshot how the demo test you are going to give. So do not forget to do this. Please just take 15-20 minutes and familiarize yourself how the portal, so that when you start the exam, you are not in a panic mode and you are relaxed. And my dear student, the notes super simple. Every student has told that, sir, once you've seen your videos, in 2 hours we can revise the entire notes. Even if you don't want to change your notes, that is okay, but please enroll in this. This is going to be your rank changer booster. I'm guaranteeing you it's going to be life-changing thing. Just give 4 hours. As you know, OBGY is a single most important subject. 20 MCQs are going to be expected, and I had conducted a 6-hour live session. Easily you can see at 1.5x speed. Just give 4 hours on my app. Download the OGGuru app, 249 rupees. You are going to get 6 hours plus of MCQ. Whichever source OBGY you have studied from, it's a MCQ based revision. These are only MCQ, question answer, how to approach the MCQ, which options to rule out, everything I have discussed. So, and we are going to have 3 sessions you will get. One is the image based and video based question, then all the clinical MCQs in Obs and Gynae, and the expected MCQs coming in this year NEETPG for Obs and Gynae. So just my dear student, 249 rupees, just dedicate 4 hours on my app, and tremendously your rank in OBGY will get boosted up. 4 to 5 MCQs, surely more. If with your current knowledge you are getting 10, 11, 12 MCQs in Gynae or OBGY correct, after this just 4-hour session, the score can jump up to 17, 18, 9. 5 MCQs more, 20 marks, my dear student, is the difference between rank of 400 and 4000 or 4000 and 40,000. So do not miss out on this opportunity. Download the OGGuru app and enroll in the rank booster. It's kept it very nominal, 249 rupees for everybody. And this, my dear student, will happen with all of you. All these lovely messages, sir, all questions were asked from your notes and MCQs. All questions, all 22 from sir's videos and notes. OBGY absolutely cakewalk. Same thing will happen with you, that when you will MCQs directly, sir, from MCQ MCQ discussion videos. Same thing will happen with you, same format like MCQ discussion videos. Same thing will happen with you, my dear student. When you will walk out of the NEETPG, you will message me, call me, that sir, we have done very, very well. So do not panic. Keep the stress level to lower. Just focus on studies. I will also be coming out with one more video on what are the last minute preparations, what you need to do overall from the NEETPG, and how many questions to attempt. All that we'll try to tackle that in that session. But this was a hit list from my side to give you the most important topics, like the must know topics, the desirable to know topics, and the new topics or virgin questions which have never been asked but can come. So please prepare those also very well. Do not forget to follow us on Insta, and please share this video with all your friends. Hype option aayega, hype this video and share this video with all your friends and colleagues, and subscribe to the YouTube channel for many more things. And on the Telegram, this PDF I will upload on the Telegram so that all of you can go through it afterwards also. So here's wishing you all the best for the upcoming NEETPG examination. Bye bye, best of luck, and thank you very much.